Hello, everybody, and welcome to this evening's virtual roundtable discussion, COVID-19, the Great Depression, and the battle between memory and forgetting, sponsored by the Living New Deal's New York City chapter. I'm Peggy Crane, the director of the chapter, which operates under the aegis of the Living New Deal, the California nonprofit that has been mapping New Deal sites around the country and bringing public attention to what the New Deal accomplished during an extraordinary decade in our country's history. But before we get started, let me share some bad news. Rob Snyder, who conceived and organized this evening's event and who fully intended to serve as its moderator, is sick with, you guessed it, COVID. Rob, we're all sending you our warmest wishes for a quick recovery. So just so you know something more about Rob, he's Professor Emeritus of American Studies and Journalism at Rutgers, and he's also the official historian for the borough of Manhattan, where I happen to live. Beyond the academy, he has devoted his career to writing and teaching about the history of New York. So here I am, taking his place tonight, a formidable task. Thankfully, he sent me a script as well as a PowerPoint presentation that I'll share with you later. Now, I'll proceed to read the introduction he sent me. Then I'll introduce our speakers and pose the questions he formulated to each speaker in turn. So just imagine that I'm him. Here goes. This panel has a history worth recalling. In the darkest days of the pandemic in New York City in April 2020, Rob organized a Zoom meeting of historians, folklorists, documentarians, and archivists. They asked themselves two big questions. What history would they need to learn to respond to this crisis? And how should they document it? Historians David Rosner and Janet Golden gave them a lesson on diseases and public health. Then they searched for historical precedents that might help them understand the crisis. Was COVID anything like AIDS, SARS, or the flu epidemic of 1918? Josh Brown of CUNY hit the nail on the head for many of us when he suggested that the proper precedent for understanding COVID-19 was not previous epidemics, but the Great Depression. And when Karen Kruse Thomas, who's with us tonight, later published an op-ed arguing the same point, Rob thought he had a topic worth chewing on. Both the Depression and the COVID pandemic raised profound questions about the role of government for public health and welfare. And the trauma of the Depression was addressed vigorously by the New Deal. For decades, Democrats invoked memories of the Dust Bowl and breadlines to affirm the value of activist government. Many of the historians who gathered with Rob in the spring of 2020 expected that the pandemic would be met with a robust and improved version of the New Deal. But to their surprise, responses to the pandemic have fallen short of their expectations. The federal response to COVID has been significant, but well shy of a second coming of the New Deal. And if anything, the pandemic has sharpened the polarization seen in America today. We don't even have a widely shared understanding of what we've experienced and what we've learned. So the big questions for the panel tonight are, number one, does recalling the Great Depression and the New Deal help us understand the age of COVID? And number two, what must we remember from COVID to secure public health in the future? Our panelists are prepared to address these questions in contexts that range from New York City to the rest of the United States. So first, let me introduce our panelists. Meet Dave Chokshi, clinical MD, a clinical professor of population health at New York University and senior scholar at the CUNY School of Public Health and Health Policy. Dave led New York City's response to the COVID-19 pandemic as the 43rd commissioner at the New York City Department of Health and Mental Hygiene. Sharon Musher, associate I hope I'm pronouncing that correctly. You'll correct me later. Associate Professor of History at Stockton University in New Jersey, is the author of Democratic Art, The New Deal's Influence on American Culture. And finally, Karen Kruse Thomas, staff historian at the Johns Hopkins Bloomberg School of Public Health, is the author of Deluxe Jim Crow, Civil Rights and American Health Policy from 1935 to 1954, and Health and Humanity, A History of the Johns Hopkins Bloomberg School of Public Health from 1935 to 1985. So, deep breath. Let me start with you, Dave. So let's see. You have argued, according to Rob, that New York City's response to COVID has been marked by waves of collective amnesia. Why do you think this has been the case? And what have been the consequences?
Well, first, Peggy, I just want to say thank you to you for stepping in as our moderator this evening, and to the Living New Deal for having what I think is such a supremely important conversation. And the reason why is through this first question about collective amnesia. And I think that it applies, not just to New York City, but to our country as a whole. I think of it as maybe three, categories of forgetting. The first is how we have collectively forgotten those dark days, at the beginning of the pandemic, which are certainly seared in my memory, given what we went through in March of April of 2020 here in New York City, but which I'll elaborate a bit. I don't think we act as though those are as recent as they were. The second sort of category of forgetting that I think about is the forgetting that happened within this pandemic, from wave to wave. And this really struck me, when I was serving as the city's health commissioner, how even when we were in the third or the fourth or the fifth wave, it was as if the conversations began again de novo about what was going to happen on the upswing, the same debates about the protective measures that should or should not be taken. All of those played out in the public dialogue as if we hadn't experienced it all, in prior waves. And then the third type of forgetting that I think about, and obviously my colleagues Sharon and Karen will be able to speak to this far more profoundly than I can, but is the forgetting of how this compares to other catastrophic events, over the course of American history, whether it is the Great Depression or the so-called Great Influenza, which the 1918 pandemic was known as, or what we experienced in the 19th century, the sort of successive epidemics of cholera and typhus and smallpox that gave birth to our public health apparatus in the first place. So those are the three categories of forgetting that I think we are susceptible to, and that I'm most interested in figuring out how we can guard against and make sure that we bring forward in a way that honors the memory of so many people whom we've lost, over 1 million lives in the United States alone, so that we can do better for the future.
I'm going to jump ahead to a slightly later question, just because it seems that you've raised it. What should we remember about the pandemic in our city? What are the most important things that we need to remember to guard against future crises?
Yeah, well, I alluded to the dark days in the first wave, here in New York City, and like so many other, public health workers, healthcare workers, I will just never forget how tragic and how painful those days were. Mm-hmm. I remember the freezer trucks outside of our hospitals that were set up as portable morgues. I remember looking at the models, the spreadsheets of what was going to happen given the exponential rate of rise, that we were seeing. I remember walking to my neighborhood hospital where, I would make rounds with the infectious disease doctors, I remember the silence because our city was shut down, and how that juxtaposed against the din of the alarms clanging and the chaos of heroic clinicians trying to save lives, and people having the worst experience of their lives inside of those hospitals. So so those are some of the very visceral memories that I remember. But the other part of your question is about our collective remembering, and for that I have to turn to the notion that one of the things that got me through those very dark days was the belief that finally we would be shaken out of our complacency, that things like universal health care or massive investment in public health, or the ways in which we would finally bring racial equity to the fore when we talk about health and healthcare, that finally we would kind of be shaken by the shoulders in a way that would reset the conversation in a way that we hadn't been able to do in the United States, prior to that point. And fast forward to 2022, and I have to admit that hasn't really happened. As you said in your introduction, it's not the same as what gave birth to the New Deal with respect to our leaders, particularly our political leaders, reaching back to those tragic memories as motivation for us to put something different in place. I'll just offer one metaphor. I've struggled with talking about the right metaphor to describe what I've the sensations that I'm trying to put into words. But the best that I can come up with is it's as if we have all survived this catastrophic earthquake, the aftershocks that we continue to experience, notwithstanding, but we are survivors, and 1 million of our fellow Americans were lost in that disaster. But there are so many people who are walking around today acting as though, we should just return to our lives as before the ground shook, or that we shouldn't focus on building structures that are less fragile for the next time that we encounter, those tremors. And so I think those are some of our responsibilities to ensure that we do bring our memories into the foreground.
That's amazing. So let me just ask, let's see how we're doing on time. We're actually doing very well. I'd like to ask you a couple of sort of more systemic questions as a public health expert. You, not me. As you look, okay, first of all, the New York City public health system actually has a long history. And it's been around for as long as I remember. What strengths did you inherit from the past? And what weaknesses did you inherit from the past?
Yeah, well, I felt so lucky to be at the helm of what I consider a world-class health department, arguably, the strongest local health department in across the globe in the New York City Department of Health and Mental Hygiene. You're right; it has a long history. You mentioned in my intro that I'm the 43rd commissioner, and the first commissioner, was actually tapped in the middle of the 19th century. In the wake of those successive epidemics, that I talked about. It was part of the Great Sanitary Awakening, the idea that, the deaths that were being seen from cholera in particular, many of them concentrated among the poor, many in New York City among, immigrant populations, that something should be done, and that was really the impetus to start thinking about health, not just at the individual level, but at the population level and collectively. And the notion that maybe we all have, a public responsibility for those conditions that give rise to health and not to illness. I think that's the greatest strength, is to trace that lineage of heroes, who changed the status quo to say that it wasn't acceptable for so many children to suffer and to die, before they reached the age of 5. There were a number of strengths with respect to the way in which our public health system was organized as well. Focus on social factors and their connection to health, a very robust, system of clinics and partnerships with, community-based organizations. So, I could go on about that, but the other piece of it that you asked about was weaknesses. And, I think we saw the weaknesses of public health and, our health systems during this pandemic as well. A big one that, I think of as maybe like the tectonic plates that really, underlay the earthquake that I described, is how trust and polarization, and racism and poverty, those underlying conditions give rise to illness, and particularly vicious cycles that lead to illness and perpetuate, some of those conditions as well. And our public health system doesn't yet have sufficient standing nor sufficient resources to really reckon with those more fundamental drivers of health. And that's something that, I hope will be a lesson that we carry forward in terms of the investment that's required, for a public health system to actually reach further into not just the causes of disease, not just heart disease and cancer or a virus like COVID, but what is sometimes called the causes of the causes, the ways in which racism and poverty, and trauma underlie why some people live healthier lives than others.
Thank you so much. That is great. So does anyone else have a comment on anything that Dave has said thus far? Yes, Karen, unmute. Yeah,
just thought you made such a great point about fatalism and not really seeming to learn from previous catastrophes. And one thing about the earlier history of public health, people were so excited about the power of public health because there were so few effective treatments. Mm-hmm. And so, and I think one of the things that happened in the early 20th century was that Americans moved from a real fatalism about death, that there was just nothing you could do. If you were religious, you would think of Job after all of his family members died, saying, the Lord gives and the Lord takes away. But public health, created the expectation and the hope that death could actually be prevented. And it even went further to say it was immoral not to prevent it. So, but I think there are a lot of things that happened after the early 20th century that began to complicate that.
It's amazing. I'll just say one thing, which is that, Dave, although I'm not an expert in public health, I studied global health for a year at University of Copenhagen. And the first day, our professor came in and he drew a graph on the board and he showed that in 1910, in Copenhagen, 1 out of 9 people died of TB. 1 out of 9. Those are basically third world rates. And how did they solve that? Well, just as you said, sanitation, housing, ending overcrowding, improved nutrition, all those things. So
yeah, it's the way that I remember reading, one writer put it is, if you were writing a history of the last 200 years, the headline would have to be the doubling of life expectancy, around the world. It's an extraordinary, societal achievement that we we mostly take for granted, in the modern day. And so I think that's very much to your point. And one related thing that I do want to just mention before I yield back to you is, even within the pandemic, we got a glimpse of public health being able to do big things again, and certainly the vaccination campaign, which I'm very proud of, the campaign that we led in New York City. It's the largest campaign in the history of our city, of course, over 6.6 million people vaccinated. We estimate approximately 50,000 lives saved as a result of the vaccination campaign. And it was a gargantuan endeavor. It was not just a whole of government approach, it was a whole of society approach. We spent billions of dollars in New York City alone to accomplish this extraordinary thing. And even as I described the catastrophe and the tragedy, which is very true and part of the COVID experience that we do have to honor, we can't forget that we moved mountains during the pandemic, and we're capable of doing that. We're capable of achieving the big things that we associate with historical eras like the New Deal. But we have to propel that forward and not get stuck back in the same ruts, in the same dialogue, that was antecedent to the pandemic in the United States. Thank you.
Thank you so much. All right, well, let's move along to our next speaker. So Karen Kruse Thomas, whose op-ed piece about making this amazing connection between the current pandemic and the conditions that prevailed in the 30s and early 40s during the Depression. And that the points of similarity and the points of difference between these two periods. In any event, the first question for you, Karen, is you've argued that it is a mistake to narrowly focus our discussions of the history of the COVID pandemic to the 1918 flu, and that instead we should compare it to the Great Depression and the Dust Bowl. So why do you think that?
Well, for a couple of reasons. Although the Great Pandemic does have a lot of obvious similarities to the COVID pandemic, but it was not a novel virus. The influenza strain had been around for a while, and in fact, that's why so many younger people died, because the older people had already experienced it. So it wasn't the only two truly novel viruses that have caused pandemics, over the past 100 years are HIV and SARS-CoV-19. So anyway, but I think that the reason I chose the Great Depression as such an apt comparison, we were just talking about, the excitement and the hope over rates of death and disease beginning to fall as you apply sanitary measures and begin to get effective vaccines and things. But the Depression showed that wasn't a smooth upward curve that of life expectancy or that. So the Great Depression represented a huge setback to the nation's health. And I think COVID also, we have been so used to life expectancy just continuing to go up and up and up. And actually the Bloomberg American Health Initiative Summit just pointed out that over the past 6 or 7 years, life expectancy has really dropped considerably in America. So when we were facing COVID, I don't think we could quite wrap our minds around how profound of a threat it was, or how just far-reaching and universal it was. We were because I remember in the beginning, we were hoping it would just stay in China, those of us here in the United States, but of course that did not happen. But finally, I'll just say the Great Depression and COVID, the Great Depression caused tremendous economic and health consequences, and that is also true of COVID. So I think that's very important to recognize. So thanks.
Yeah, it's sometimes when I think about it, and which is not that often, because as Dave points out, it's just so easy to slip into a kind of denial or amnesia. But the impact of the Depression and the Dust Bowl, not only on people who were adults, but on their children. I mean, it had that kind of intergenerational impact, and
Right.
and the economy and every aspect of life, really. And it seems to, but I think it is similar in that way. Do you think so too?
And I should have actually referred directly to the Dust Bowl. The Dust Bowl really quite literally swallowed up entire towns and communities, and it was so very sudden. And I think the suddenness of the Dust Bowl and the enormous just black dust storms that swept across the Great Plains, the prairie, I remember the COVID pandemic. Suddenly, the governor of Maryland said all of the schools are going to be dismissed because of the pandemic. And I thought, how can that possibly be? Like, what's happening? And then all of us were sent home from my office, and suddenly, like, everything was completely different. It was just a complete shift in reality. And so the Dust Bowl was a lot like that as well. And, the dust was so pervasive that it got into people's dishes, and it also caused dust pneumonia, and especially a lot of children died from that. So, it was causing some really unprecedented and very widespread health problems.
Yeah. So you've just a little slight change of topic. You've written that the appeal of national health legislation to address the country's need for universal health care surged during World War II. I had no idea. Why was that so, do you think? And what happened to that legislation? Why is it forgotten?
Well, so, I mean, the Great Depression and World War II are really I would say, a continuous historical period. And, when I teach US history courses, the New Deal was amazing, but there was only about 1/10 of the government spending on the New Deal as there was on World War II. And it was that really lifted the nation out of the Depression. So as far as national health insurance, I mean, I think that the 1940s are really the time period that we had the most likely chance of passing national health insurance. And it's a bit sad in some ways, because I would like to believe that people in government and the public would witness the tremendous suffering of both the poverty and the terrible health problems that were going on in the 1930s, and they would just want to do the right thing and try to help people. And certainly the New Deal did that. But World War II was, I would argue, the most powerful rationale politically for health reform of any in the 20th century. Because there were kind of two really major pieces of legislation. The first, of course, was the Social Security Act, and Title V is really the foundation of our modern public health system. It set up grants to states to create full-time health departments. It sponsored the professional training of public health workers. It created a lot of maternal and child health programs. And so it, that 1935, like right in the middle of the Great Depression turning point. I mean, I think, certainly Social Security is really a centerpiece of the New Deal. But then it was in 1944, the draft rejection crisis, where 50% of draftees were rejected because of both health and illiteracy were the cause. And so we had, even kind of hard-bitten conservatives that hated the New Deal said, well, we've got to be able to mount an effective fighting force. And so this became a new rationale for health reform.
Fascinating. No idea. So one more question about your research and your writing. Rob tells me that your historical research is grounded in the history of the South.
Mm-hmm.
What do we see when we compare reactions to the Great Depression and the reactions to COVID in the Southern states?
Well, so I did my PhD at the UNC Chapel Hill. I worked for the Southern Oral History Program, which was a really life-changing experience. And as a historian of civil rights and health policy, I think that one of the profound realities of the South is how anti-federal and anti-government the South has really always been, except in health reform in the 30s and 40s. And there was this very odd mixture of Southern segregationists, Black medical activists, and Northern New Deal liberals that somehow managed to agree that we should have hospital construction, federal funding, and more money for public health and money for medical education and all these things. And each one of those three groups had very different reasons for supporting health legislation, but the Southern politicians who dominated Congress, because it was a one-party South, and of course, many Blacks across the South were could not vote. They used that to, they wanted to bring money into their districts, and they were incredibly good at doing that. And Lister Hill, who is really most famous for garnering support for the NIH, but he also was getting a lot of money sent to Alabama. And so the part of the country that got the most federal funding during the New Deal and during World War II was also the most anti-federal part. And that continues to be true today. There are statistics about the amount of federal aid that the Southern states receive, vastly, compared to their, contributions to the in taxes. There's just no comparison between the Southern states and states like Massachusetts or California. So anyway, I don't know if
that's really,
but there's a lot to unpack there.
Yeah, definitely. And in a way that sort of leads to the
and anti-federalism, of course, I think really was a huge part of the response to COVID, or more accurately, the lack of response to COVID, was that anti-government sentiment.
Yeah, exactly. That was Rob's last question for you, was, is the polarization of American life today in part a consequence of the political turns that the US has taken since the era of the New Deal?
It is.
Yeah.
I think that in the New Deal, the South was a much more monolithic region, but Malcolm X actually said that Mississippi is everywhere below Canada. And I've always remembered that. And so I think over the course of the 20th century, certainly we have the great migration of African Americans out of the South. And that means that the problem of racism and segregation spreads, to places like Chicago, but also some of the ideas that used to be really characteristic of Southern segregationists start to go more mainstream and become part of the conservative movement of people like Barry Goldwater and George Wallace, who won the primary in Wisconsin in 1968, I believe. So, basically those beliefs that seem so confined to the South early in the 20th century become, part of the conservative politics of the 80s, 90s, and then today.
And has the South also experienced greater numbers of center and center-left people?
Yes, one great example of that is I've done a lot of research on the very rapid growth of medical schools because they were considered such great economic engines is part of why. And anyway, but those new medical schools at Southern state universities recruited all sorts of people from outside the South to come and create this new institution. And it was many times it was those people who led, for instance, the desegregation of Birmingham, alongside the native Birmingham civil rights movement. There were people who had come into the University of Alabama at Birmingham, which started out as a medical school and not a full university. And they were really instrumental in the civil rights movement as well.
Well, gosh, I would love to get, comparing the New Deal with the current moment especially the achievements of government. Although I wanted to say one other thing about the New Deal, which is that it was not, to my understanding, as top down as many people think. A lot of people out there think that it was just kind of basically the federal government doing its thing. But
no, a lot of the New Deal programs were grants to states.
Exactly. And they even worked with the private sector when they found it expedient to do so. So, wow. Well, so let's see. We're doing still pretty well, but I think it's time to move on to our last speaker. And then let's see if we can have a little time to interact, and then we'll open it up. Okay?
Sounds great.
So Sharon, how do you pronounce your last name?
Musher.
That's what I thought.
You got it. You did just right. I was just muted when I was agreeing. Sorry.
Excellent. So let's see. We'll start with the first question Rob has posed, which he says the subtitle of your book, Democratic Art, takes us right to the question, the New Deal's impact on American culture. What was that impact, particularly with regard to how Americans might become healthier?
Okay, great. So answering that question depends, of course, on how you define American culture. And a lot of my work focuses on the New Deal's art projects. So I'm going to say a little bit about that, but I'm going to bracket that first because first I want to answer the question more generally in terms of the New Deal's impact on American culture and society. And this actually goes back to something that Dave said at the very beginning, where he was talking about hoping that COVID would impact our sensibility more, make us think in broader ways about how we were going to deal with inequity, how we were going to deal with racism in public health and in our society more generally. And the New Deal fostered a new ideology that saw the federal government playing a large role in people's everyday lives. And that impact was in part economic. It created a basic safety net through unemployment and disability insurance. We mentioned Social Security before. Of course, these policies weren't put into a place in a completely equitable way. Agricultural workers, domestic workers, African Americans in large numbers were left, and women in large numbers were left out of this kind of safety net. But it was a new idea, and it was an idea that had all kinds of tangible consequences. The New Deal created an infrastructure that we still encounter in daily lives, and that the Living New Deal documents so beautifully through its map, the schools, the libraries, the post offices, the roads, and the bridges. So that's my broad argument about the New Deal's impact on American culture and society. In terms of the arts part of that, the New Deal democratized culture. The art projects helped to democratize both the creation and the experience of art, of creative styles and artistic subjects. It nurtured creativity and creative people, and not just those people that were broadly known to be famous and whose styles were approved at that time, because it gave money out on a relief basis. It nurtured creativity and a whole host of new approaches, including abstract expressionism. And finally, it fostered empathy. New Deal art drew attention to previously neglected people, including former slaves, the so-called common man, and there are real debates about who was included in that common man or not. But it helped to build empathy across differences and create cultural understandings. And that was a kind of ideology too, a cultural ideology that undergirded New Deal policies and a new way of thinking about government's role in society.
Well, so you've looked at an enormous amount of art produced under the New Deal. When you contemplate the country and the political order that produced that art, how does it differ from the political order of the US today?
Right. So I just talked about one of the key impacts of the New Deal as being this creation of essentially a New Deal order, and understanding that the government needed to intervene in the economy, and that the government should help to tip the scales, to help strengthen smaller forces, whether those smaller forces were migrant workers, industrial laborers, artists, the elderly with Social Security. In that environment, it was possible to imagine FDR experimenting with a series of executive orders that would create work relief for the unemployed, including Federal One. Federal One, between 1935 and 1937, hired roughly 40,000 artists, writers, actors, dancers, and musicians to create millions of public works.
It's just,
we live, in fact, he's saying it's just, because it's just unimaginable in the world that we live in today. We are in a totally different era, even though the needs could be considered equivalent. We live in a post-neoliberal world. We're fractured between conservatism and radicalism. We have no consensus between them.
mhm.
We've been so fearful of what the midterm elections would bring. Biden tried to find common ground, working through a divided Congress to pass COVID relief bills. There have been some efforts in this moment to revive New Deal style art projects, the 21st Century Federal Writers Project Act, and the Creative Economy Revitalization Act, but they've stalled.
Wait, what was that one? Can you tell us a little bit about the second one?
Sure. So the Creative Economy Revitalization Act was very similar to Federal One. The idea of hiring artists and intellectuals on a relief basis. And in fact, where we have seen the most growth in terms of investment in artists and the arts has been at the local, regional, and state level. And California has created this Creative Workforce Act. It's underfunded, and it's just in California. And so I think that the effort to create a national act has been influenced by California being able to pass something on the state level. But we're living in a very different political order, and that shapes what the possibilities are,
Yes.
even as we might hope for something, or some of us might hope for something different.
Yeah, well, it's probably beyond the scope of this evening's discussion, but to create a culture of greater solidarity, of empathy, as you said, one that is less individualistic, and that is, I don't have really any idea of how to bring that back, other than to show people in any way we can these examples of when it was different, and encourage them to think about that. Wouldn't it be great if we had that again?
I think that too. I think, I think a lot about the model of the arts and the art projects. And one of the approaches that I write about in my book that New Dealers used was this idea of art as enrichment. And the idea was that local communities would focus on their stories of origin. They would tell the tales of the heroes and heroines from the place where they emerged, and they would create it and picture it on murals in their local post offices. And I don't want to bring people down, because I would like to be as hopeful as possible, but we don't believe today in these common myths. It's so hard to bring people together. We can't agree on what should be taught in schools. We can't agree on books that should even sit on the bookshelves in libraries. I mean, in that context, how can we paint murals on walls with common stories that bring us together to see our humanity, and to want to create public policies, health policies among them, so that everybody is treated with respect? I don't have solutions.
Amazing. Well, speaking of murals, here's just a little more that Rob wanted me to read to you, and to the audience, of course. So he says, in the tense days when historians in New York debated what to do in response to COVID, their ideas varied. One of Rob's colleagues created a website, while another started a digital collecting initiative. But Rob has been struck by two kinds of projects that sprang to life in New York City that resonate with the New Deal. In April 2020, there was talk of doing a lot of oral history projects, exactly the kind of work done by the Federal Writers Project that would document the pandemic from the ground up. These have proven so varied and abundant that Rob is now editing a book of oral history interviews, journals, poetry, and first-person narratives, setting down New Yorkers' responses to the pandemic. The other impulse, in a more indirect but significant way, was to create murals, a staple of New Deal public art projects, and now the subject of an exhibit at the Roosevelt House Public Policy Institute at Hunter. Well, by the way, the address, this exhibit is still on, and I think it will run through February 24th. The address, if everyone wants to take this down, is 47-49 East 65th Street. That's on the Hunter campus. And by the way, it is sort of a double townhouse, which was Eleanor and Franklin's first home. But in any event, to get back to the topic, that exhibit, Healing Walls is what it's called, Health and Art in New Deal, New York, curated by Deborah Gardner, a member of our wonderful chapter, examines a major New Deal program that hired artists to paint murals in various public buildings, including 18 hospitals in New York City. The exhibit runs through the 24th of February. And Deborah's exhibit is tied to a new book called Healing Walls, edited by Rick Luftglass and Jan Rothschild. The book documents the historical context and achievements of a more recent program funded by the Laurie M. Tisch Illumination Fund that produced 26 murals in public hospitals and health facilities in New York City now, or recently. So it began before COVID racked the city, and its works were not conceived as a deliberate reprise of New Deal arts programs at the time. But if it started before the pandemic, it continued through the pandemic. And it does echo the New Deal's emphasis on art to heal, and to build solidarity among doctors, hospital staff, and the public. So anyway, it's kind of amazing. Erica, could you show the slides from that that exhibit? These are the new murals. Yeah. Amazing. 2021. Yeah, wow. Amazing. That's the old one, isn't it? Or is that a new one? I'm not really sure. No, that's a new one. Gosh. Amazing. So basically, the final question for all three of you before we open things up to the audience. So some people, this is straight from Rob, some people say Americans love a tragedy with a happy ending. Is there a danger in seeing a happy ending to COVID? What do you think?
Don't see a happy ending to COVID. Have we seen a happy ending to COVID? I mean, we've learned how to live with the pandemic. I love seeing, but I did want to comment on those images that you just showed, and then we can go back to Rob's closing question. But yeah, those are really beautiful, and I do have a slide too, and I'll wait to show it later, of posters that were created in New York promoting public health. And I actually went back in and found the Federal Art Project posters that also called for vaccination preventing smallpox and keeping up with science. I certainly do think that there is a role for the arts in bringing us together as a people, but COVID is not done. And all of the questions that the pandemic raised about our society, about how we take care of those who are most vulnerable, they're still there. And, you know, as Dave mentioned, we may have this amnesia that makes it go away, but it's our responsibility as historians, as public health officials, and as citizens to keep those debates up in the forefront.
Yeah, I very much agree with that. I also want to comment on the murals, which I think are so powerful. And I know actually Rick from the Laurie M. Tisch Foundation is in the audience this evening. He and the foundation, along with Health and Hospitals, the public healthcare system for the city, deserve so much credit for bringing that to fruition. And I do think it will have a real impact, you know, as we hopefully continue to emerge from the pandemic. And I'll just give you a little glimpse into that. I was actually at Elmhurst Hospital last week. It's my neighborhood hospital. It's, you know, just a few blocks away from where my family lives. And it was, you may remember, you know, the hospital that was featured in the news reports from the really devastating days in April of 2020. That was just inundated with patients, and it's hard to keep that in your mind when you're visiting the hospital unless you have something that allows you to connect back to it. And I think that's really what the mural represents. It was one of the first ones that you showed that had the phrase Elmhurst Strong. You know, that was kind of the motto that really was redoubled during the pandemic. And so I think it's such a touchstone for people to keep memories alive and to, you know, to keep that spirit that that so many people felt during the pandemic, and to connect it to the response to this question. I mean, I agree with Sharon. First of all, you know, are we going to get to an ending, much less a happy ending? And I just don't think, given the tragedy that so many families have experienced, you know, 200,000 kids in our country alone lost one of their primary caregivers due to COVID-19. So there's just no happiness you can wring out of that. But I think maybe the more appropriate way to think about it is what is the phoenix that can rise from the ashes? Like what is it that we can use to motivate, the big changes that we do need to see, and it starts with this, with the collective remembering and with honoring the memories of those whom we lost.
Well, thanks to all of you for your part in doing just that. I know everybody out there appreciates it greatly. So if we have like 1 minute to 9. So if anybody has something more to say on this theme or on another.
I did have a quick observation. I was listening to Sharon talk about, the power of these murals and this art. And like there were absolutely parts of the New Deal that were really unifying and amazing, but I don't want us to lose sight of how divided America was in the 30s as well. And so the US Congress just steadfastly refused to pass a federal anti-lynching law throughout the 20s, 30s, 40s, and we finally passed a kind of a token version of it just I think this year or something. But so I don't think we should sugarcoat the New Deal. I think there were one of the things that made people more willing to experiment and try new things like contemplate national health insurance was there was like it really hit people at all levels, and the physicians were so they had lost so many patients economically, not that that was the one of the few times when people who were very in favor of fee-for-service medicine softened their attitude a bit toward government assistance and began to accept it because they just had almost no patients in their offices. And so, but on the other hand, many of the strongest pushback against some of the new, really visionary New Deal programs was because of racism. The Social Security Act did not cover farm workers or domestic workers. And so anyway, my point is we see, I think it's accurate to say the COVID pandemic really exposed, or we saw how divided America could be, but the same was true in the New Deal. And there's just a real vicious opposition throughout the New Deal. People, and the Republican Party, as well as many of the Southern Democrats, were trying to undo the New Deal just as soon as possible. And I kind of see that with some of the really hard-bitten resistance to, mask, or even the current resistance to the federal vaccine mandate, for instance, that desire to undo that progress as soon as possible. So anyway, I'll stop there. But
I know that I and my friends agonize over these questions constantly. And somehow I don't feel as if I understand them well enough to make a real difference. Like what the why behind it, the why behind vaccine, not only vaccine hesitancy and resistance, but outright opposition. It's so absolutely bewildering to me even to this day. But I guess we could get onto these subjects and wander a little too far away from our assigned task here, which is to make these connections and to probe the relationship between remembering and forgetting, and why remembering is so incredibly important. All right, well, let's see. What do we have some questions out there? Let me open up the Q&A and see if there's anything going on. Yes, so there's a question. Oh boy, there are all kinds of questions. Let me see. Here is a question that is mainly for Dave, but not only. It's from David Levine. I assume in your public service years, you've spent time in working sessions with top policymakers, mayors, governors, secretaries of health, etc. Do you have any opinion on whether they are even capable of making connections, such as COVID and, you know, the relationship between COVID and the Great Depression? I mean, would they be open even to, you know, contemplating this? He says, my sense from afar is that they become so mission focused that they don't ask questions such as, what did we learn the last time we were in deep distress? What did we do when we were drowning? What worked then and what didn't?
Well, yeah, I'm happy to start. And thank you, David, for this really interesting question. The short answer is yes. I do think that at least many leaders are capable and in fact are very motivated to reach back into history, particularly in times of crisis.
Mm-hmm.
It certainly depends on the leader. I think President Obama is likely more probable to reach for the book than President Trump may have been, but with that said, I can just share my own experience, particularly during COVID, and maybe I'll give you the little funny anecdote. I'm somewhat embarrassed to say that I only read one book when I was serving as health commissioner for New York City, because I was working, many, many hours a day. And but the one book that I reached for was the Great Influenza by John Barry. And, my wife kind of poked fun at me. She said, so you want to try to fight COVID, 20 hours a day, and then in your rare free time, like, this is what you want to do, is read about another pandemic. But the truth of it was that it was, I don't know, comforting is not the right word, but it was, it gave me a sense of the historic significance of what we were doing. And that was a real solace to me as I was dealing with a very nitty gritty, on a day-to-day basis. So it's important. And, I do, particularly for this audience, channeling history in ways that are accessible to leaders, to policymakers, particularly during times of crisis, is very important. Even if it's not the leader themselves, it may be an advisor or, the health commissioner, rather than the mayor or the governor, who will benefit from that and, who can carry that forward.
Great.
Just wanted to add one small thing, which is I have a sort of bottom-up teaching response to that, which is that in teaching about the 1930s in the midst of COVID and teaching on Zoom with graduate students and undergraduates and just people feeling very lost, one of the things that they found a lot of consolation in was listening to Stud Terkel's oral histories of, how do people deal with the Great Depression? How did they manage it emotionally? So this is not at all about leadership and the lessons that they acquire. It's more about, how do we live through hard times? And I think that my students at least found some consolation in those words.
Oh, that's wonderful. What else? So let's see. Here's a question for Karen. Can you please detail some of the New Deal public health programs in the South from, I think, hookworm, clean water, privies, and that sort of thing? This is from Dick Walker, who is the director of Living New Deal.
Yeah, so the Rockefeller Sanitary Commission started the hookworm campaign in the South in, I believe it was 1909. So that really predates the New Deal, but it was, it's widely seen as kind of one of the the key starting points of American public health when like the idea that I was talking about before, that prevention was a viable thing, that if you had, sanitary outhouses and got kids to wear shoes, and then there was, Thymol that would flush out the worms from your system, that could actually make a huge difference, and not only in the health of the South, but in the economy of the South, because hookworm was considered the germ of laziness. And so, there's always been a strong connection between health reform and labor, because even if you're, even if you're not a very humanitarian person, you want the labor force to be able to perform. So, but the New Deal programs in the South, and I want to, they were all over the country, but they were especially transformative in the South, because the South was Surgeon General Thomas Perrin, who was appointed by Franklin Roosevelt, called the South the nation's #1 health problem. And then the South was also the poorest region of the country. And so programs like training folk midwives in more modern scientific principles to assist women in labor and reduce maternal and infant mortality, that was that was one of the things that the Social Security Act helped to fund. And the draining swamps and places that were breeding mosquitoes that would spread malaria and other, we still had malaria in the United States until the 1940s. I think it's also important to recognize that the New Deal in public health also had a profound effect on segregation and race relations. Perrin did support, he strongly supported bringing many, many more African Americans into the public health workforce for both practical and idealistic reasons. And I don't want to get too off track. There are some very negative things about Thomas Perrin and his involvement with the Tuskegee syphilis study, so I don't want to let him off the hook. But he's a very complex figure, and I wrote a lot about him in my first book. But he himself was a Southerner. He grew up on a Maryland tobacco farm, and he really he saw the South as a national public health laboratory. And so he pioneered all sorts of really interesting, innovative ideas in public health that really focused on the South.
So another comment quickly for Karen. This is from Gray Brecken, who is also, I think he's the founder or co-founder, I'm not sure which, of the Living New Deal, which was about 15 years ago, I believe. He says, Karen is correct that the Depression initially caused a sharp decline in public health. But the network of hospitals, clinics, sewers, clean water supplies, modern schools, etc., to fight the Depression were new and ready to go after the war. Mm-hmm. Shouldn't we give that matrix credit for life extension after the war? Although, as Dave says, the COVID catastrophe shows that we learned little, if anything, from that epic initiative.
So public health and hospitals were a really critical part of the building projects of the New Deal. Mm-hmm. So in addition to roads and bridges, they built a lot of hospitals. They built mental hospitals to TB sanatoria, and the buildings for public health departments even. But it wasn't the New Deal. I mean, I don't want to diminish the importance of those building projects, but it wasn't until the end of World War II and the return of, relative prosperity. In 1946, Congress passed the Hill-Burton Hospital Survey and Construction Act, which for the next, 40 plus years really helped to build the modern American hospital infrastructure that we have in this country. And virtually all of the hospitals built during that period, which many of which are still with us today, were built with that federal aid. But, you know, so I think that the Hill-Burton Act was actually kind of the last, you know, true New Deal program to be passed by Congress, because it was that that idea of addressing the, you know, it was meant to bring hospital care to areas that had absolutely no hospitals and very few doctors. And it was really quite successful in doing that.
I'll just add a little bit on the second part of Gray's comment to say, when we contrast that to, you know, what's happening in the modern day, well, there are two examples that come to mind. One is on the healthcare side, and one is more on the public health side. In terms of healthcare, I think the story of Medicaid expansion in our country is so illustrative in many ways that that both Karen and Sharon have alluded to in their comments. But we had, you know, Medicaid expansion was, if you remember, encoded in the Affordable Care Act and was supposed to occur on a national basis. You know, it was one of the most significant parts of the coverage expansion in the Affordable Care Act. And then it was the Supreme Court that deemed that that should be left up to the states. And that's how we got this piecemeal, you know, state by state decision making about who would expand Medicaid. And as a doctor, I just have to say how dismaying it has been to see that conversation play out, where even with very strong economic incentives to expand Medicaid, you know, in conservative states, there are 14 as of now that have still not done so. And this is something that doesn't just make sense from the common sense perspective of giving people health insurance coverage. There is very robust scientific evidence showing that it saves lives, you know, in places where it has been expanded. So so it just shows, you know, how sort of different the valence of the conversation is even before COVID. And then the public health example that I'll give just briefly is one of the other achievements that I'm really proud of in New York City is having launched something called the Public Health Corps, which fundamentally was, you know, the workforce that we should have had in place before the pandemic. So we were able to get initial $235 million investment, piecing together both city and federal funding, you know, for the first 2 years of it, to very, you know, robustly expand the public health workforce, particularly around community health workers across New York City. But despite some efforts on my part, that is not at all in the national conversation right now for us to say we just went through this public health crisis where the workforce, which was already eroded even before the pandemic, is in dire need of shoring up. But that is not it's not even an agenda item for the Democratic Party, you know, right now, because of the challenges of actually getting, you know, funding for pandemic response. So, you know, so both of those examples just came to mind in terms of the contrast of what the situation was like in the wake of a prior crisis compared to this one.
I have a question for Sharon. You mentioned in passing, you know, just you raised the question of what is meant by American culture. Because, you know, that can be viewed from so many different angles. It's, you know, like a prism. But, you know, there are times when I feel that there is a long tradition of boosterism and over positivism in the country that has been working against public health, because people just do not want to face these things. They want to think everything is rosy. And the people who come along and dispute that and say, and oh, they're just saying doom and gloom and the you know, what do you think about that? is what I'm saying historically valid? Is it the case that this is a long cultural stance in America?
I have to think about that more. I mean, I do think that there has been a tradition of boosterism, but artists don't usually toe the line. And this is part of why government funding of the arts is so controversial and so difficult, because the kind of art that I was talking about before, that art as enrichment, showing images of, the foundational story of a little town and the like, most artists, certainly anyone who sees themselves at all as avant-garde, didn't want to do that kind of boosterism. That kind of boosterism was tied into, promoting travel and, go see this town because this is part of their tradition and the like. And it was very hard to get artists in line with that vision. And that was part of there wasn't a shift between the Treasury Department, which funded these murals in these public buildings, like the ones that you see in the hospitals, where you have to have consensus around what will the messages be, and will they be messages that the doctors and the nurses and everybody comes in, the patients are going to feel good about. You need to do surveys on what are people going to feel good about. There are only certain artists who are willing to do that kind of work, and there was a very different model that came into place through Federal One, through the Federal Art Project, where essentially artists were paid as relief workers because they had some kind of credential. They had gone to art school, or they had worked in the field for X number of years. They had some kind of credential, and they proved that they didn't have a job and they didn't have income, and they needed that kind of support. So I think there are real tensions. I think there is this tradition of boosterism, but I think there are real tensions between getting artists in line with that. And something like, I mentioned before, and actually I can share my screen and show you the posters that I mentioned before. The posters over here then are from the Federal Art Project, and you can see Keeping Up with Science, Is Your Child Vaccinated? Vaccination Prevents Smallpox. I put up this winter in Fairmount Park because I live in Fairmount, and I thought it was so lovely, and I just found it, and so it struck me. So forgive me on that. But getting artists in line with promoting certain ideas, messages about public health, that's much easier to do than getting them in line with promoting that kind of boosterism.
Yes, totally agree. So let's see, we're almost at this point, but I want to just share one other comment from Deborah Gardner, who we mentioned earlier has curated this fabulous exhibit at Roosevelt House. She says, what about considering that a major difference between the crisis of the Great Depression and the crisis of COVID was the quality and impact of national leadership? FDR's ability to inspire and his funding of national programs versus Trump's disavowal of leadership over COVID, not only disavowal, but antagonism to acknowledging the dangers of COVID. So she's saying that, there's also this whole role for national leaders and leadership.
No question about that. National leadership plays a huge role. And I know I was nodding vigorously when Karen was talking earlier about the dissent. That it wasn't just a rosy story. Yes, absolutely, that was true. But one of the things that really stood out to me as a difference is the way in which FDR used executive orders. The WPA, relief work, that whole project was through executive orders. It wasn't trying to pass legislation. And there are real problems with that. And, the Democrats lost in the midterms elections after that, even though, FDR won by a landslide in 1936. So, there were pros and cons in terms of creating change. But I think leadership makes an enormous difference. So absolutely.
I agree.
I would add to that, one of the really, amazing things about the Roosevelt presidency is that he served, he was reelected 3 times. And a lot of that was because, we didn't want to, quote, change horses during a national crisis of the Depression and then World War II. So it's really telling that during, this enormous COVID crisis, we did indeed change horses. So I think that tells you a lot.
It does. It sure does. Well, we really are running out of time, but there is still time for any of our three speakers to add anything that you feel you didn't get a chance to say or that you wanted to elaborate on just a little. Just say 2-3 minutes.
Well, just to build on the last strand of conversation, when I was preparing for this evening's discussion, I came across a great FDR quote that I just wanted to share, which points up his leadership. And the quote was, "We cannot be a strong nation unless we are a healthy nation." And the way in which he brought that to bear, in the investments in the public health infrastructure, as well as the healthcare investments that Karen talked about, were really remarkable and set in motion so much of how we think about the fundamental nature of health, among Americans. So I think we have to get back to that sentiment and not just think about, health from the individual perspective, but for us to remember, as we saw, of course, during the pandemic, how much our health is intertwined with that of our neighbors. And so how, it's connected to us being a strong nation as well.
Thank you so much for that. By the way, Gray Brecken also said, don't forget Eleanor's leadership. And absolutely, we won't forget. There's no forgetting tonight. That's not allowed. Yes, Sharon.
I wanted to thank Peggy and Rob for bringing us together. I'll confess that when Rob told me about this initially, I wasn't really sure how it was going to work. How were we going to talk about public health and the arts, and how were we going to kind of circle that square? But I mean, one of the profound things that COVID taught me, and I think so many of us, was the importance of the arts and culture and how they feed and fuel our souls, and how much our mental health matters, and what the consequences of isolation are. And, I think of that more when we have this discussion of leadership, the idea of FDR speaking to people in their homes, through their radios, sitting in their living rooms with them. And I think about how we all have been walking around with our phones, with our podcasts, with our, connections to the world, and what that must have felt like to have a leader speaking in ways helping people to see one another, and ideally to create a more equitable world, even if the New Deal fell short of that vision. I think COVID has shown us how much more work we still have to do. And I hope that the New Deal will serve as at least a partial inspiration in terms of bringing us there.
And maybe I can sort of tie all this together. So I think in the New Deal, like one of just the iconic things about the New Deal is those posters of, the anti-syphilis posters and and they relate, strongly to both World War I and to war posters, fit to fight and all that. And so the New Deal, World War II era and the COVID era both gave rise to these very distinctive artistic styles that really, grew out of and helped to define those eras. And in the COVID pandemic, and I'm going to give a bit of a shout out to the communications team at the Bloomberg School of Public Health where I work. Unfortunately, the CDC had difficulty in communicating to the country. And, they're just, you cannot, like when I was a kid, you just said, go get vaccinated and everybody did. And it was really widely accepted that vaccination was a great thing because people had still, were old enough to realize that, what happens when you don't vaccinate kids. But during the COVID pandemic, there were so many innovative, things on social media and new types of art and communication that were really like stepping in to fill the void. And so one that I thought was a really great example of that was, it was a meme that our communications team came up with that it took the Home Alone movie and the scene in the movie where the two bumbling robbers are trying to Macaulay Culkin is like throwing things down the stairs at them. They were the two different variants of COVID, and then he was throwing, the different vaccines at them, and it was really effective, and a lot of people loved, and so finding I think the New Deal art and art during COVID found new ways to communicate really important basic messages that were, very much of their time.
Thank you. Thank you so much. It is actually 9:30. That's amazing. So I'm just amazed, but thank you so much, all of you. I actually learned a lot, and I still have a lot to think about as a result of tonight. So let's see. I just want to thank you guys. I want to thank Erica, who can show up if she likes again. There she is. Thank you, Erica, for managing this wonderful event and doing such a great job. And our audience, I'm so sorry I didn't get to everybody's questions. It was just impossible, and I was like trying to concentrate on too many things at once. But it's really been great. And we hope to continue to offer these kinds of programs in 2023, preferably as hybrid events with an in-person option for New Yorkers or visitors to the city. So, if you're in a position to support our efforts with a donation of any size, that would be awesome. And if you aren't, there are other ways to express your support. Tell your friends and colleagues about us. Write to us at livingnewdealnyc@gmail.com and send us your ideas. And if you aren't familiar with the Living New Deal's amazing website, that needs to change. Go to livingnewdeal.org and start exploring. You won't believe what you'll find there, including an interactive New Deal map of the entire country. So listen, thanks again so much for joining us. Thank you, everybody, and see you next time.
Thank you.
Okay.